Good day, I'm Dr. Russell Raath. I'm a medical specialist, I'm an anesthesiologist, but I have not been practicing as an anesthesiologist for the past 12 years because I've been devoting my full time to the management of chronic pain. And fibromyalgia is a very large part of a chronic pain practice. When I started this practice 12 years ago, I secretly hoped the fibromyalgia patients would not hear of me or get my address. But they did. And they came. And I was very embarrassed by the lack of anything that standard of care medicine had to offer these patients. We did not know the cause of fibromyalgia. And anyway, most doctors were in denial that it even existed. And they were on huge amounts of analgesics, opiates, and antidepressants, anti-epileptics in an attempt to smother and suppress the pain. I decided in my heart at that time, this is unsatisfactory and there must be a better way to do this. So I devoted my time, effort and money to finding a better way to treat fibromyalgia. And I do believe I have found it. You are watching this video for one of two reasons. One, you yourself are a fibromyalgia sufferer, or two, you have a loved one who is a fibromyalgia sufferer and you are just tired of seeing them suffer and suffer and suffer and lose their quality of life and just exist and find no relief or help anywhere. They've most probably, or you have most probably seen myriads of doctors, countless specialists to no avail. You've tried every alternative treatment there is, but it hasn't helped. You've even tried weird things that you've read on the internet or somebody's told you at a party or over a braai that this will help, and you've tried it, but it doesn't help. You see, these treatments and everything that you've tried is treating the pain and not the cause of the pain. Now, I know you think you have tried everything, but you haven't tried everything. I know you haven't tried everything because you haven't tried this. You see, if you were to use an analogy of a fire, if you have a nice fire going and it's producing a lot of smoke, and the smoke is bothering you, the smoke is really irritating you, you've got two options. One, try to deal with the smoke. Put fans up, suction, air conditioning, scrubbers, whatever. Try to get rid of the smoke. But the smoke will always be there because the fire is burning. Would a better idea not be to put out the fire? And then the smoke will go away. Now you see, in your case, there's a condition or a state that is the fire. And the pain is the smoke from that fire. And all these treatments are trying to just treat the smoke of the fire without ever treating the fire itself. A much better way to treat fibromyalgia then is to obviously treat the fire. Let's put out the fire. Just treating pain, as you know, just trying to deal with the smoke is an exercise in futility. You see, lots of doctors argue that fibromyalgia does not exist. And I agree with them. They're quite correct. Fibromyalgia is not a disease. It's not a sickness. It's not something you picked up somewhere. But it does exist in that it is a state or a condition that your body is in. It has long been known, and I've attended many lectures in my life on the fact that fibromyalgia is an inflammatory condition, inflammatory state in the central nervous system. But I've never heard a lecture on where this inflammation comes from. Of course, the brain and the spinal cord and the nervous system is all part of the body, and their inflammation is part of a whole body inflammation. And this is a concept or a term you're going to hear a lot more of from medicine in the coming years, as it has been linked, this chronic, low-grade, subacute inflammation has been linked to many diseases that are increasing, such as heart disease, diabetes, Alzheimer's, Parkinson's, autism, ADHD. All these things have been linked to inflammation of the brain, mostly, excepting in heart disease and diabetes, it's inflammation in the rest of the body. So we've got this inflammation in the body. Now, at my practice, we've developed protocols to put out the fire, to deal with this whole body and nervous system inflammation. First, we will reduce the inflammation that you do have, and not with the use of anti-inflammatory drugs, as that is also just treating the smoke. It is not treating the cause of the inflammation, just the symptoms of it. And then we will treat you and show you what to do to reduce the cause of this inflammation. We will show you how to prevent the inflammation from flaring up again. So we'll help you get the inflammation under control, and we will then show you how to keep it under control. So if you come and visit us in our practice, we will help you put out the fire. That is, deal with the inflammation you already have. 2, we will keep the fire out. We'll keep the fire from flaring up again. And this we'll do by treating the cause of the inflammation and showing you what to do to keep it under control. And then the pain, the smoke, should reduce or go away, or at least become responsive to the pain medication again, because the fire is out. So we will show you how to put out the fire to get rid of the smoke, to treat the condition, the cause, to get rid of the pain. I would really like you, if you've been suffering for a long time, to just give this a try. Come to my practice, and once you've tried this, you can honestly say you have tried everything. You can contact my rooms on 012 344 198. That's in Pretoria,